Hi, I'm Betty. I need to do a wound assessment before I change your dressing using aseptic non-touch technique. Is that okay with you?
Yes. That's okay.
Before I start, I'll just pull the curtains around to give you some privacy. I'll close any windows to ensure your safety. Then, I'll sanitize my hands for 30 seconds using hand gel.
Okay.
First, I need to check your ID. I'll take a quick look at your ID wristband, if that's okay. Can you tell me your name, please?
It's Michael Smith.
Michael Smith. Yes, that's what's on your wristband. What's your date of birth?
The 16th of October, 1987.
Right. Do you have any allergies?
No. I'm not allergic to anything.
Great. I'll gel my hands again, and put on an apron and some gloves. I'll start the wound assessment now. I have your assessment chart here with me. Are you feeling comfortable at the moment?
I'm okay, thanks.
Do you have any pain at the moment?
No. My shoulder usually hurts a bit, but it's okay now. I had some pain medication about 20 minutes ago, and it's working well.
Okay, well, I'll make a start then. I'll just loosen the dressing without taking it off completely. Before I do your dressing, I need to assess the skin condition around the wound. That will give me an idea of how well is healing. The first thing is to look at the skin color around the wound. Healthy skin is pink. Redness or erythema is one of the signs of infection. There's no redness around your wound. The skin isn't excessively dry or overmoist either.
That's good.
The next thing I'll check is the presence of exudate or wound discharge. I'll make a note of any abnormal discharge, for example, fresh bleeding called sanguineous exudate or pus called purulent exudate. A clear, watery plasma discharge called serosanguineous exudate is quite normal. Your wound doesn't have any discharge, which is also normal.
I see.
The next thing to check is the closure of the wound. Wounds can be closed by sutures or stitches, surgical clips or surgical sutures. Your wound is closed with sutures. There are no gaps in the line of sutures, which are all present. The wound edges are well approximated. That means that the wound is closed well.
That's good news.
Is it usually painful when the nurses do your dressing changes?
The dressing changes aren't painful, they just cause a bit of discomfort. I had some pain medication about half an hour ago. I'm not in any pain at the moment.
Are you okay for me to do your dressing now?
Yes, that's fine.
All right. I'll just cover the wound with the old dressing and get ready to do a dressing change using aseptic non-touch technique. If there is any pus in the wound when I do the next wound assessment, I'll take a wound swab and send it off to the lab to check for infection. It's not necessary this time.
Okay.
Now, I'm going to remove my apron and gloves and put them in the clinical waste bin. I'll sanitize my hands again and set up the trolley for your dressing change. I'll leave the call bell within reach so you can call me if you need anything before I come back.
Thank you.